Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Does anyone ever think about having their pharmacy compound their medication because it sticks as it goes down their throat? Well, you can't find compounding pharmacies easily, but we did find one, and the one we're talking to now is the pharmacist herself, who is IVETTE Bowers, and she's the owner and pharmacist of Emerald Hills Pharmacy. Thank you for taking this nice little chat we're going to have.
Well, thank you. Thank you so much for having me.
So let me ask you, I always thought that pharmacists were men. I didn't realize that I guess over a period of time, the women have come into that field also.
Oh, absolutely. Tons of us now, especially the newcomers. Yeah.
Good. So I started off with talking about compounding. I remember that there was something that my gynecologist gave me a prescription for, and I had to take it, this is years ago, to a compounding pharmacy. Now, why was that? Why couldn't just a general pharmacy take care of it?
Well, sometimes what happens is that the doctor wants to tailor the prescription specifically for the person. So it may not be available as a manufactured item, commercially. So what the doctor does is he'll write the prescription to be specifically tailored to the patient. Again, the dosage has to be correct and the quantities. Sometimes the dosage doesn't exist commercially. So we will compound it in our facility.
I see. And what does it take to compound something? I mean, you have to take the ingredients like you're cooking something?
Yeah, it's kind of fun. It's almost like a chemistry experiment, but basically it's actually not that difficult. It is like cooking. You have a recipe. The recipes are, age-old recipes sometimes, and other times they're brand new recipes that we have to actually make ourselves. And we just go by each ingredient. We don't actually even normally take the manufactured version. Like, for example, if there's a tablet on the market, we don't just crush those pills. We actually we purchase powdered medications that are specific to compounding, and then we go ahead and we compound them. Those are kind of interesting because you actually have less inert substances, which means there's no other stuff in it other than the actual medication, and then maybe, like, say, for example, a cream base if we're going to make a cream. So it's usually a more pure form of a medication.
I see. That's a very good explanation. So I could literally have a pharmaceutical and take it to you and tell you that I don't want to take it this way and I want you to compound it, and you could?
We could, yeah. We could do it, like, say, for example, if it's something that's only available in a tablet, but you need to have it for whatever reason into a liquid, we can compound that into a liquid so that it goes down faster, it gets absorbed faster, whatever reason the doctor may have to change it. Some people really don't like swallowing pills. Sometimes the doctor wants it, like you mentioned, in a certain formulation to be given differently than orally. So there's a lot of different reasons why compounding is done, and believe it or not, it's a very, very, very common practice, and it's been done for years and years, hundreds of years.
I didn't know that, but I was thinking about what you said. A lot of older adults cannot swallow pills.
Yeah, it's very common. Even children, even though there are a lot of suspensions for children, for adults, there really aren't very many options many times. And so even, I would say antibiotics are, different because a lot of people, there's a lot of antibiotics that come in a liquid form on the market commercially, but in other formulations and other drugs, it's not available in a liquid form. And so if a patient, whether it's an adult or a child or whatever, can't take it orally, we tend to have some cancer patients that maybe if they have like throat cancer, they can't swallow a pill, so we'll we'll make it for them in a liquid, and we've done that many, many times. But yeah, it could be done for all age ranges.
I see that. My guest is Yvette Bowers, who's the owner pharmacist for Emerald Hills Pharmacy. Is your name actually Emerald Hills Pharmacy or Emerald Hills Compounding Pharmacy?
It's actually Emerald Hills Compounding Pharmacy, but we are a regular pharmacy as well, so we don't want that compounding pharmacy to yeah.
Let me give everybody I just want to make sure we do this right because we're so happy to have you on the radio show. The phone number, everybody, just get your pencils. This radio talk, it's Pencil Talk Radio, and it's the phone number for Emerald Hills Compounding Pharmacy, which is really a pharmacy too. I'll say that now, is 954-983-3336. Again, 954-983-3336. And something I notice is you have free delivery.
Yes, we do. We actually do have free delivery. We deliver to a pretty large range in Broward County and even in Dade County. So we go as far north as Palm Beach and as far south as Miami.
That is so good. And so many times people get home, they're sick, they have, the doctor calls in a prescription and they're not going to get up and go get it. It's too hard.
Yeah, if you're sick and you're not, picture somebody who's got the flu, poor thing, and they can't come to get their medication. We love to deliver their medications and make it so much easier for them.
Well, that's great. Now, tell me a little bit about your pharmacy. If I went there, and I will be going there, what do you actually have besides being a pharmacist?
Yeah, the pharmacy is actually a really cute little place to visit. It's in the form of an old apothecary, and that's just an old time word for a pharmacy, and it looks like an old time pharmacy. Walk in and it's got like the dark wood and the shelving. All it's missing is the ice cream parlor, which we actually plan on doing.
You do? Oh, really?
Yeah, we do plan on having an ice cream parlor in there with the root beer floats and all kinds of fun stuff. But that's going to be a little bit further in the future. But you walk in and it's just a really fun place to be. We're constantly testing out new aromatherapy products. So the pharmacy always smells really, really nice with one smell or another. It's usually we usually have a cashier up in front to greet every single customer that walks in. We have personal service. The pharmacist is always there. We have the availability of the compounding pharmacist in the back who can answer any questions as well. And usually delivery is same day as well. I forgot to mention that earlier. So it's just kind of a cool place to visit. Even if you don't have anything to purchase, it's fun to just walk in.
You sound like a cool pharmacist. I mean, you are so enthusiastic, and now I see it took the woman's touch, all the things that you're telling me.
Yeah, thank you.
Let me ask you a question. You know what's happening with the CBD oil and all. Are you carrying any of that?
We actually do, yeah. We carry two different companies, and those companies were handpicked by us because there's a ton of companies out there just trying to sell their product, and we make sure that the two companies that we picked are very reputable. They offer organic CBD. We carry not only the actual liquid, but we carried it in a pill form, and we also carry it in a cream form, which is a huge hot seller. But we do have a lot of different dosages available. Gummy bears. It's kind of like an interesting selection of different products that we have, but it's a big interest right now.
I know. I'll tell you a funny story that I do have my dog on some, and I actually got this dog. I adopted it, and it had a little rat. It's a Shih Tzu, and had a little rat tail with not a lot of fur or hair on the tail. I will tell you something, that since I've been giving him some of this, there's hair growing on his tail now. I mean,
really?
I must be going crazy, but my friends, everyone sees it. Look at the hair on his tail.
Oh my goodness,
that is funny.
wonderful.
I know it is. Well, I look forward to meeting you. I have to tell you, you're quite a woman, and you're doing something really great there. And I'm glad that we've been talking about this. And I had just one other question, though, that I know I can only ask a pharmacist. When my doctor prescribes medication and he gives me a choice of having the generic or the actual drug, I know the generic's a lot less expensive, but is there a difference in the two?
Well, there's not supposed to be, no. The manufacturers that make the generic versions of brand name medications are supposed to follow FDA guidelines. And those guidelines are to make the medication exactly as the active ingredient in the brand name. You're really taking the same thing. All that's different is the inactive ingredients that they may have chosen. Maybe the coloring of the pill is different. But as far as the active ingredient, has to be the same dose, has to be the same strength that the brand name medication comes in. And it's a law. It has to be the same. So you really shouldn't be scared about taking the generic. Usually, the dosing is exactly the same. So I wouldn't worry too much about the generic versus the brand.
Okay, that's a very good a very good answer. The other question that I had too is, a lot of times you get pills that are certain colors, and then the next time you order them, they're a different color. Should you worry?
Right.
Should you not check the colors and say, "Oh, something must be wrong"?
Well, I always tell my customers and patients, make sure if you're not sure, call the pharmacy and double check, because you never know. There have been mistakes made by pharmacies, so you never know. However, most likely what it is that it is just a different generic version, a different manufacturer of the same medication. So you may have gotten, say, Mylan from one and a different manufacturer, the next time, and they do look different. And like I mentioned, they do use different inactive ingredients, different coloring. So even though the likelihood is that there is nothing wrong, I would always double check. And if you're not certain, make sure you call and double check with the pharmacist that you did get the right medication.
Okay, and my guest is IVETTE Bowers, who's the owner and pharmacist of Emerald Hills Compounding Pharmacy, but it's really a big pharmacy anyway. And we now discovered that not only do they do free delivery, but they also have some CBD products that you can talk directly to the pharmacist. Let me give you their phone number. Remember to write this down. It's Pencil Talk Radio, 954-983-3336. Again, 954-983-3336. Yvette, thank you so much and enjoy your trip.
Thank you.
Look forward to meeting you.
Thank you.
Bye.
You too. Bye.